Doctor, does diabetes have any connection to asthma? They seem completely unrelated to me.
Actually, diabetes does increase the risk of asthma. Studies show that people with diabetes are about twice as likely to develop asthma.
Really? How does high blood sugar from diabetes relate to a higher risk of asthma?
Great question. Diabetes often triggers chronic inflammation throughout the body. This inflammation can also affect the airways, increasing the risk of asthma.
I see. So diabetes can increase asthma risk. But could it also work the other way around? Does having asthma raise the risk of developing diabetes?
Exactly. Asthma also causes chronic inflammation in the body, which can affect how insulin functions. This may lead to unstable blood sugar levels and an increased risk of diabetes.
So asthma can negatively affect blood sugar and make diabetes more likely?
That's right. Research confirms that people with asthma have a higher risk of diabetes. Long-term inflammation makes blood sugar control more challenging.
Are these risk levels based on reliable data? I'm starting to feel anxious about this.
I understand your concern. Rest assured, the data comes from large-scale clinical studies analyzing thousands of cases. The results are highly reliable.
With such extensive data, it's hard to ignore.
Exactly. These studies have clearly established the connection between diabetes and asthma.
But why does diabetes make asthma more likely, and why does asthma increase the risk of diabetes?
It comes down to inflammation and the immune system. Diabetes makes blood sugar management harder and creates a state of chronic low-grade inflammation, which makes the airways more sensitive and increases asthma risk.
So diabetes and asthma both worsen each other's effects?
That's correct. Asthma's chronic inflammation can disrupt blood sugar control by reducing insulin sensitivity. This creates a cycle where one condition exacerbates the other.
If someone has diabetes or asthma, are there ways to prevent or manage the risks?
Absolutely. Regular checkups and appropriate treatments are essential. Consistently managing blood sugar levels reduces inflammation, which helps both conditions. For asthma, maintaining airway health through respiratory care is crucial.
I haven't thought much about respiratory care. What can I do for that?
Avoid smoking, engage in regular moderate exercise, and eat a healthy diet. These habits help reduce the risks of both conditions.
That makes sense. Is there anything else to focus on?
Improving your overall lifestyle is key. Along with quitting smoking, exercising, and eating well, prioritize quality sleep and stress management. These help reduce inflammation and make managing diabetes and asthma easier. Stress, in particular, can disrupt blood sugar levels, so finding time to relax is very important.
I see. If there are changes I can make to my lifestyle, I want to try. Where should I start?
Start by improving your diet. Foods rich in vegetables, fruits, and fiber, like broccoli, spinach, and seaweed, have anti-inflammatory properties that benefit both diabetes and asthma. Reducing sugar intake while maintaining sufficient protein also helps stabilize blood sugar and boost immunity.
I'll work on my diet. I'm also a smoker, though. I guess I should quit, right?
Yes, quitting smoking is crucial. Smoking irritates the airways, worsening asthma, and damages blood vessels, exacerbating diabetes. To start, set a clear goal for quitting. Seeking support from a smoking cessation clinic or using nicotine patches can help. Declaring your intent to quit to friends or family can also provide encouragement.
Quitting sounds tough, but I'll give it a try. Exercise is important too, isn't it?
Yes, regular exercise is vital. It helps manage blood sugar and supports respiratory health. Start with light exercises you can do at home, like squats, stretches, or walking. A morning or afternoon walk is especially refreshing and helps relieve stress.
That sounds doable. I'll review my habits and start with small changes. Thank you so much, Doctor.
You're very welcome. Managing diabetes and asthma requires long-term commitment, but gradual improvements in daily habits and consistent treatment will help reduce risks.
Talking to you made me realize how important it is to take care of both conditions. Could you summarize the key points for me?
Of course. Diabetes and asthma are interconnected, with each condition increasing the risk of the other due to chronic inflammation. Large-scale studies confirm this link. Reducing these risks involves improving lifestyle habits such as quitting smoking, exercising, eating a balanced diet, and managing stress and sleep quality. Small, consistent changes in your routine will lead to significant health improvements over time.
That makes sense. Thank you for the detailed explanation. I feel more reassured now.
I'm glad to hear that. If you have any more health questions, don't hesitate to ask. Don't forget to subscribe to this channel for more health tips. Check out our other videos for helpful advice, and I'll see you next time.